Bipolar disorder causes abnormal shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks.
5.7 million adult Americans are affected, as many as 60 million people worldwide. More than half of all patients begin seeing symptoms between the ages of 15 and 25, but it can begin at any age and there is no known cure. Research shows that people with certain genes are more likely to develop bipolar disorder than others.
Variations in many genes, each with small effect, may combine to increase the chance of developing bipolar disorder. This includes the genes shown here.
Environmental factors also contribute to a person's risk of getting bipolar disorder. Stressful events can trigger symptoms. Associated with bipolar disorder are substance abuse and traumatic head injuries.
Are you at risk for bipolar disorder? JJSK genetic test has been created to detect genes associated with increased risks of getting bipolar disorder.
The test tests for about 20 variations in alleles that are associated with the changed risk of developing bipolar disorder. The SNPs are included on the slide.
Specifically, 2 genes have strong predictive values. The one on the left is located on chromosome 12, while the one on the right is located at chromosome 2.
This test is extremely beneficial because it can indicate the likelihood of getting a trait correlated with bipolar disorder. For example, say your test results come back for a variation in the SNP in the slide. If your genotype is CC, you are at a normal risk. If your genotype is CG, you are at a 1.8 more likely to get bipolar disorder. If your genotype is GG, you are 2.1 times more likely to get bipolar disorder.
Why does it matter? Knowing if you are at a higher risk for bipolar disorder allows you to make important decisions regarding family planning, and so you can be aware in case you start exhibiting symptoms.
On the negative side, it can create placebo-type effects, cause excessive stress and anxiety, and cost money that is directly needed in the moment. Although SKJJ genetic test does have some limitations, it often can't determine if a person will show symptoms of a disorder or how extreme the symptoms will be. For example, having the phenotype CT in the SNP listed indicates a 20% decrease in the risk of getting bipolar disorder, but this is only a very small increase.
For example, someone might test positive for the variation of the SNP listed, risk allele AG. This would increase the risk 1.4 times more likely to get bipolar disorder. Still, this person could not get bipolar disorder at all in their life. Other warnings and ethical considerations. Emotionally, the stress of impending test results. Also, stress of how society would view you after an official diagnosis. Also, the worries of how you're going to continue to care for your family or care for a future family. Also, financial warnings. As mentioned before, the raw cost of such a test, the debt that could result, and the money possibly going to a medical monopoly and contributing to keeping this technology just above the general public's grasp.
Is the SKJJ genetic test for you?